Hi, this is Ashley from Portland Wellness Care, and we're going to go through a few more advanced knee rehab exercises. These are going to be designed towards developing even more strength and stability, not only in the muscles right around the knee and connecting to the knee directly or crossing the knee joint, but the ones higher up in the hip and even lower down through the foot and ankle. So this is more of a kind of final picture, getting back to your full kind of complete ability to do everything that you normally do or would do prior to your knee injury. The first one I'm going to show is an elevated bridge. So lying on your back, heels are going to be pressing into an elevated surface, and it can actually be a little higher than this. So think about in the gym, kind of a weight bench. That's also an appropriate height. You just want to make sure it's a stable object that you're pressing your heels into. Then keeping a nice neutral back, you'll dig both heels into the bench, squeeze through your glutes and hamstrings, and lift your hips up so there's about a straight line from your hips, shoulders to your knees, and slowly lower back down. So you want to go nice and slow on the way up and on the way down to develop concentric and eccentric control. That is kind of a contracting, shortening, and lengthening version of strengthening the muscle. Another way to make this a little tougher is single leg. So you'll pull one knee towards your chest, just hold the back of the thigh with your arms, root the shoulders into the ground, and drive through that heel again as you lift and lower, nice and slow. So this will be a lot more focal through the hamstrings and glutes on one side, a little more effortful. And then a few other ways to develop a little more stability involve balance and stepping onto a high object. So transitioning from here, the next thing we'll do is a step up. So you'll place your foot on a surface that's elevated and stable. A staircase works pretty well, but you can also use any firm, stable object, even much higher than this, as you get more stable and build more strength and range of motion in the joint. But you want to send your weight forward, press to that heel, and try not to jump off the lower foot behind you as you press up. I like to also bring the opposite leg forward and move my arms kind of in a running motion with the legs. So coming down and pressing back up all the way. This is kind of a step forward motion. You can also perform a lateral, that is a side-stepping motion here to develop stability. So I like to start with the foot on here, and then for the knee that I'm trying to strengthen or stabilize, which should be both, but a little more on that one that's injured. You're gonna just send your foot out to the side, send your hips back, lower down so you tap the foot, and then come back up. So it looks a bit like a single leg squat with a slightly lateral intention. I'll show that from the side as well so you can see the posture of the spine and the hips. Coming down, coming back up. Aside from that, you'll just want to work on single leg balancing in general. It's a really good idea to strengthen through the pelvis. So one pose I like to use to get both the pelvis, the hips, and the hamstrings is just called an airplane. So that looks like standing on one leg, hinging from the hips, keeping a nice neutral back, tilting forward until you are almost level to the ground or just to a level that you can support. Slight bend in that standing leg. Then from here, you can have your hands on your hips or you can fully airplane the arms out. And then you can try eventually practicing rotations. So this top hip is contracting and rotating you, different directions. And you're building more stability, both through the pelvis and then also through the foot and the ankle muscles, creating kind of a full continuous set of activation through the leg. So just a few ways to really fully develop more of that proprioception, so awareness of body parts and space, allowing your brain and kind of neurology to catch up with the healing process. I hope these help.